Hello, welcome to another video presentation on cognitive assessment. Today I want to talk about the difference between the task of the psychometrician and that of the clinician. Too often, I believe, the clinician's role is reduced to no more than that of a psychometrician in the interests of objectivity. I believe this is a misunderstanding of the whole realm of objectivity. In truth, the clinician's task and the psychometrician's task are very different. The psychometrician is asked to administer tests according to the rules, adhere to the instructions religiously, establish rapport only in order to get optimal effort, and to not ever intrude on the testing process, become personally involved with patients, or give feedback before the end of the testing session. This is appropriate to the psychometrician's role, but it is far too limited for the clinician, who has to try to understand the nature of any cognitive impairment and the contribution of that impairment to a possible diagnosis. The clinician's task is to understand the patient, understand the experiences during testing, the experiences of symptoms, to investigate test performance problems that arise sufficiently in order to discover the meaning of the eventual poor scores that are obtained. In this way, the clinician is able to identify useful diagnostic information and formulate and test hypotheses about the brain. The clinician, in going beyond the psychometrician, must become personally involved with the patient in an interactive way. It is okay for the clinician to ask questions, to give second chances on a test item, to challenge responses that are thought to be inadequate, to restructure tests to see if it has an impact on performance, to extend time limits, to ask for and give feedback to patients in an interactive process, and even provide assistance with a test in order to gauge the impact on the patient's ability to perform. You see, the clinician must incorporate an objective test administration, but not be limited by this in what takes place during the testing process. Next time, I'll be talking in more detail about the nature of objectivity and its limitations. Thank you.